Morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today I wanted to talk about a very interesting topic, and it is one of my special interests and one of my specialization. It's about breech presentation and normal delivery. Actually when you have to talk, when you do your ultrasounds and when you do your scans, say in the 7th month or so, when you do the growth scan, 20% of pregnancies show that the head is up and the bottom is down. So that is called breech presentation. Actually speaking, the head of the baby is a heavier thing, and the head has to be down for a smooth happening delivery. Now, if the head is not down, you can have your shoulder that presents, you can have your that is called as a transverse lie, or sometimes the cord is down, sometimes the breech is down. Breech is the bottom of the baby, which is presenting in the lower part of the uterus, that which is going to come out first. So when it is breech delivery, people do ask me, is normal delivery possible? When we have to talk about deliveries and how deliveries were done and how deliveries are still done in multiple number of places, I cannot have my single opinion. When countries analyze the data and give and set rules, they analyze data and set rules for all kinds of people, where healthcare facilities are available, where healthcare facilities are not available, where only midwives do deliveries, where only dais do deliveries, where only junior doctors do deliveries, and where obstetricians do deliveries. So they don't have separate rule and regulations for different scenarios. But then nationally they have their own set of rules with their past experiences and with whatever they have seen in terms of things happening and risks happening. So in such a perspective, breech delivery, wherein the head is not down and the bottom is down, the process of delivery and the progress of delivery and the outcomes of delivery were not happy, were not very good. So definitely they have addressed to this situation and told that if breech is the one that is presenting in the first pregnancy, then it is an ideal way to do a cesarean rather than going for a normal vaginal delivery. Now this is a perspective. This is a national perspective. This is by rules for the RCOG, by rules for the UK guidelines, by rules for the Indian guidelines. But it is not the rule for every given situation and every given institute. And the places where I work, and I have a team of people to support me. I do deliveries in a very sophisticated place, and there's an operation theatre room very well next door. There's a blood bank, there's anesthesia services round the clock. So in such situations, if I don't do breech deliveries safely with the training that I have, who else will do? My perspective is only my perspective and my individual decision to go forward. And I cannot do breech deliveries for every breech presentation. There is an ideal situation wherein the pregnant woman, the partner, the family is highly motivated to give her a normal delivery. Especially the pregnant woman is motivated to have a natural vaginal birth. The diet is under control. The weight of the baby is under control. There are no other complications. Mostly it should be a very good position in breech also. Breech also there are 3-4 positions. We're going to talk about it. If such levels of motivation are there and she is taking a conscious decision, then what is stopping me from conducting a breech delivery? I have enough of training and I do breech deliveries in such situations eyes closed, because it's nature who is taking care. It's the woman who is determined. It's the partner who is trying to give support. I should be able to deliver my services in such situation because I am trained. And whatever consequences come, we should be able to handle them. So that is what a perspective means, and that is what that should be the driving force, and not rules and regulations which are set as a universal standards, taking into consideration multiple situations and multiple aspects of healthcare. And they actually, breech has an implication when it is still presenting as breech after 37 weeks of delivery. And there have been so many instances in the past 22 years that I have been doing deliveries, that tomorrow, if the woman is not accepting for a normal delivery, or if they are fixed to go in for a vaginal, not to go in for a vaginal delivery and go in for a cesarean, I even check on the operation theatre table whether it is still breech or not. Because there are instances in transition from the admission to the delivery on the table, there was a shift in the position and head came down. So before I even start anesthesia, I check personally that it is still breech. And if it is only still breech, then we give, for their choice. And then if it has become head, then definitely shift out and go ahead with the normal protocols that are there. So wonders do happen, and I have seen them happen many number of times. That is why, in my experience, it is very important that at the time of delivery, you have to recheck whether it is head down or not. And they say there is increased perinatal mortality, increased perinatal morbidity, and the chances of birth asphyxia, and the chances of prematurity and congenital malformations, all these things in breech. But this consensus is there from entire country. So wherever the breech was conducted without experienced people, or just like that breech came out and there was an untoward event and there were no trained people, there was no trained setup, there was no neonatologist to even do basic resuscitation. So all these things and factors come into consideration when we talk about its complications, and when we talk about what can cause these problems. And there are about 3 different positions in breech also. When the baby is sitting in the fetal position, the legs are bent, and at the hip joint and also at the knee joint, so it is completely flexed. That's called flexed breech. And when the legs are flexed at the hip joint and the knee joints are extended, so the legs come like this on near the face, so that is called extended breech. And when the legs are flexed, semi-flexed, and the foot is coming down as the presenting part, that is called footling presentation. So in these 3 presentations also, footling presentation is absolutely no for a normal delivery. Usually extended breech gives very good outcomes, and flexed breech, a fetal position of flexed breech also is not very bad. And as I have told you, 20% of pregnancies look breech at 28 weeks, but then you have a choice at that time. At 28 weeks, if you have seamed and registered a breech position, there are exercises, there are several things that you can do so that the head turns down. And as a matter of fact, if we have to talk about complications, when there is no head that is presenting now, head is round and it applies very well. Breech is not round, it is irregular, so the cord can slip down and come down, so that is called cord prolapse. These things are little bit common with the breech presentation. And when the baby delivers, head can get struck. That is another fetal head entrapment that can happen. And it is not very well applied, so the bag of membranes can open early, and there cannot be some progress of labor. And sometimes if there are other complications, they can cause birth asphyxia in the baby. And if the head is not able to be delivered correctly, it can cause intracranial hemorrhage in the baby. There is blood clot in the brain. So there are several complications, and all complications are documented in different settings. So it is not that in every given scenario these things come. No, it is not like that. So these scenarios are overall in unmonitored segment, in monitored segment, in non-trained people doing the delivery segment, and all these things. So it is very important that how you have your perception towards one problem. If pregnant woman knows about all these things, and she will definitely not want to take any risk and go for a cesarean. But if pregnant woman knows these things can happen in a low infrastructure setting, and she chooses to go to a higher infrastructure setting, she would not be at risk of these things when her delivery is happening. If the person who's doing the delivery is trained and the infrastructure is there for emergency deliveries, there's blood bank and there's NICU services, you should not worry, and you should be going with confidence to do breech, get your breech delivery done. And there are certain factors in the uterus also. At times when the uterus has a septum in the uterus and the head gets entrapped there, you will not be able to, shift down, and the head will not come down if the septum is obstructing. If there is a fibroid sitting in one corner, the head will not be able to turn down. The fibroid will be obstructing it. And if the placenta is down, sometimes it will not give space for the head to come down. So that is another reason why uterine causes can be a reason for breech. And in the baby also there are certain causes why breech presentation is there. In prematurity, as I have told you, if it is 28, 29, 30 weeks, naturally also 20% of the time breech is presenting. And if the baby is too big to even move, okay, so breech presentations are there. And if the water is too high, if the baby keeps floating, and the presentation need not be head down, it can be head up also. In twins, you can have various presentations. And when the head is not very well formed, in certain conditions like anencephaly, the head is not very well formed. In such conditions also the breech comes as a presenting thing. So it is very important that we assess the pelvis, we assess the general well-being, we assess the baby weight, we assess the mother's condition and her determination before even going for a breech delivery. And it is for people who do not have ultrasound. How do we check whether it is breech or not? But then the heartbeat is at a different level. The head is boggy and it is somewhere here, and constantly women say that something is hitting me here, doctor, it is very hard, something hitting me here, and it is very hard and it is prominent. That's the head. So that indicates that it is still breech and it hasn't moved down. And in ultrasound we can clearly figure out whether it is breech or not. And now ultrasound examinations are easily accessible and available in the remotest places possible. And there is a procedure called as external cephalic version, wherein you can turn the baby down, head down, but then that procedure per se has certain amount of risk, and there can be heartbeat variations, and it can land into emergency deliveries also. Usually we attempt this external cephalic versions in previous normal delivery, and this time if it is breech, you can try, because the abdomen is little loose, and if the water level is correct and not more, and if the baby weight is adequate and not more, so external cephalic versions can be attempted. But again, it needs its own consent form. It is it has its own advantages, own disadvantages. People do accept, people do not accept. Sometimes if the cord is there around the neck, it becomes tight when we are turning the baby, and if there are any uterine abnormalities, it doesn't turn. So if you don't know the patient from the beginning and you've done a scan and you were very assured that this is not a uterine abnormality that is causing breech, you will not know. And such situations do come. And when you do these kind of procedures, sometimes 40% of the time you can turn the head down, and in the first pregnancy, and 60% of the time in second pregnancy. But these procedures are also not very authentic. They have their own consent forms and all. People do prefer to do, they don't prefer to do. And there is a chance of emergency section if we do such a procedure and the heartbeat goes down. Say about if 200 procedures are done, one person will land into emergency. So 1 in 200 incidence of emergency cesarean is there. And there is a contraindication to do this kind of external twisting and getting the head down if they've had any bleeding in the past, if there is any water bag that is broken, or if there is high volume of water around the baby, and previous any cesareans, absolutely no. And there are several methods of naturally turning the baby down. And I have a team of people. Pratima is there, Nirmala is there. They give me a lot of support. Shija is there. So Nirmala and Pratima, especially in my setting at Cuddles, they are in charge of turning the babies down. So they give some kind of exercises. For example, the bridge tilt or the pelvic tilt or the inversion, the child pose that we do. So these things, they try naturally to get the head down. And other than these also, there are exercises like cat camel, there are exercises like some kind of walking and all that. So initially when we see in ultrasounds and growth scans that it is head up and breech down, I usually send them to Pratima or Nirmala, or they give them the training, and they make sure that most of them head down is there by the time of delivery. And there are additional therapies that traditionally people do. Some music therapy, people do when they put earphones or music at the level of the head and slowly go down on that, baby follows the music and comes down. This is what they say. And music therapy also works at times. And there is another method wherein they show difference of temperature, cold pack on the head and warm pack lower in the abdomen, and they repeat so that the head comes down. So there are other techniques in acupressure, acupuncture, wherein there are methods to get the baby head down. But all these are not very much time tested. They are done in highly motivated couples, and they are usually attempted, and it's a very slow progress. And these things, you need to have a team to do all these things. And breech deliveries are definitely not impossible. And for a highly motivated couple and a good operative setting, you can definitely do breech delivery with success. We've done say about 2 breech deliveries in the last say 20 days, and people do come from various locations other than around the hospital to get a breech delivery done, because they want a vaginal delivery at any cost. So their determination also works, their motivation also works. So it is not only about the doctor's expertise, you should also have a lot of motivation in terms of getting a breech delivery done, going through natural birthing and giving an attempt to have a natural vaginal birth experience. Nowadays, people are not having that kind of a zeal and just they are always behind a very easy thing. They think that abdominal deliveries are not painful and vaginal deliveries are painful. It is absolutely a myth, and it doesn't make sense. A cesarean delivery is painful for the next few days also. So anywhere you have to do an incision and you have to put sutures. But natural delivery is a natural delivery, and you should promote natural delivery in whatever means possible. And they have so many myths, and they go by the influence of others. So rather than going by the influence of others and making opinions, you have to ask your doctor that whether the doctor is comfortable doing a breech delivery or not. And if the setup is ideal, then you should go for it without even getting all the other things influence you and shield your confidence. So it is very important that you, as a mother, as a couple, as a family, you should have determination and positiveness to go ahead and do attempt a breech delivery. Breech delivery has to be done carefully. You need to have people around, and you need to inform couple of situations and agents and make certain arrangements. And you should do a thing that promotes natural birthing. So it should be there in you, it should be there in your doctor also, and it should be a well-equipped setup. And it doesn't happen in muhurtams, it doesn't happen on a good day, it doesn't happen just like that as you planned. So you should be free of all such social thoughts and stigmas also. It will be done in a time and frame that is very ideal for you and the baby. And you at times can't drag your pregnancy till the full term and even 41 or 42 weeks. These are all very bookish. Breech deliveries cannot be done after a certain period of time if the baby weight exceeds, if the baby head exceeds the growth. So it is also very important that you should look into the other aspects and look into a very ideal environment for the delivery to happen. So this is all about breech delivery, and this is all about giving it a try for normal vaginal deliveries, be it breech, be it vaginal delivery after cesarean. You have the technology, you have the confidence, you can come anytime for a breech delivery to me. So it is all about natural birthing, it is all about happiness, it is all about happy moments, it is all about encouraging your body to go through normal vaginal delivery. So this is all about breech delivery today, and tomorrow we're going to join yet another interesting topic to promote vaginal delivery and natural birthing in whatsoever possible mechanisms. So there are people watching around the world. If you want a breech delivery, you can come over, we will try, and definitely we'll give 100% from my side. And I have had people from very long places who come for a VBAC and breech, and for complicated cases, for low water levels and all these things. So whatever possible, I have the setup, I have the team, I have the fetal medicine backup, a blood bank backup, critical care backup, and everything. So you can enjoy your delivery and make it a blissful experience. See you, I'm signing off, and see you tomorrow with yet another topic.